Hello viewers and welcome to MedGate Today TV Digital. And this time we are at 7th edition of Thought Leadership Summit, an initiative by HOSMAC. And with us we have Mr. Mihir Desai, who is the director at HOSMAC. So we will be asking about the studies which they had on the cancer, and in the morning only they released one white paper. So let's go deep dive into it, how they conducted the study, what kind of, you can say, the outcomes they came with, and what are the future vision they are having for the industry. Hello Mihir, and thank you so much for coming here. So as I said in the beginning only, so how you people conducted that study, what was the core agenda, mission out of that?
Yeah. So as architects who specialize in healthcare, we often have to maintain databases of different kinds. One of them is spatial databases. So when we started this study, we realized that it's often important to represent what we write in these white papers and often journals or news articles. So we had fun in understanding the nature of spatial data that is required. It's mostly cities having different population sizes, and then trying to understand what are the transport corridors to connect these cities to each other. Primarily cities with cancer care infrastructure, how are they connected to the hinterland or tier 1, tier 2 cities. So it's important that when we begin such kind of analysis, we know exactly what kind of demographic we are looking forward to, what is the epidemiology, what is the trend in population growth, what is the trend in infant mortality rates, and so on and so forth.
So the kind of study which you had, so how you found the study and what kind of solution do you think that healthcare should now take?
Yeah. The most important thing what came across in today's conference also, a lot of people who work in private and public sector have often quoted that land is one of the most important resources. So when we do such a study, in order to understand where a new cancer hospital would come up, it's important that as planners, we begin to identify which are the land banks that are available within the public or the private sector, and then how to best release the potential of these lands along these care pathways. So when we began the study, we wanted to be as free as possible in being able to propose exactly where a dot location could be placed. So the moment you place a hospital in a particular area, our algorithms are able to quantify and calculate what effect that particular hospital would have. We are able to pass parameters like, okay, whether it's a quaternary care cancer hospital, is it a tertiary care, is it 300 bed, is it 500 bed, is it going to be a teaching hospital, and then therefore accordingly kind of propose as to how people are supposed to reach there, what is the local area transport, because things like chemotherapy or you have to go there often, right? So our study kind of tries to optimize those pathways in ensuring that the patient, their experience, which is already very difficult, in getting this cancer treatment, is in some way smoothened out, eased out. So that's like been our aspiration in order to facilitate.
The aspiration you people had is so motivational, and you can say it is one kind of humanitarian thing which you are doing for the people, and we appreciate it, and I hope the industry will also appreciate it. The last thing is that this time you have kept the theme of this event is emerging healthcare models, India and beyond. So what would you like to say on this?
So the thing is that as we have noticed, in the last decade or so, healthcare delivery and infrastructure was very fragmented. But now we have a very robust background, hospitals where they have applications where you can register, databases are getting interlinked, many services are also getting outsourced. So that's kind of helping healthcare providers a lot. There is also a change in the model in which infrastructure is built. Previously, it's like the government or the private, right? But nowadays, we're having build to suit models, which means that the developer owns the land and builds the asset, which is the space, right? The construction of the hospital, but the equipment is brought in by a private hospital, for example. And we have seen that in public and private sector. So these are like some of the new emerging models that are coming up. In the future, we expect that this will be even more seamless in terms of how care itself is given. We have seen that ambulatory or interventional procedures have reduced. Medicine has increased, so we have seen in some places drop in surgery and increase in delivery of medicines, and maybe that would be a different model, so we would see different kind of solutions for that in the future.
Yeah. Thank you so much, Mihir, for telling us this much knowledgeable things to our audience and to us as well. And we are looking forward to having a great session ahead, not only the 7th time, but in the 8th edition of this Thought Leadership Summit as well. Thank you so much for coming here.
Thank you.